Hi, and welcome to another live Google Hangout. I'm Dr. Jay Harness, Medical Director at Breast Cancer Answers. And I got to tell you, once again, it's a real pleasure. And it's not often that we get to welcome a guest back that we've had previously here with one of our live Google Hangouts. So, up in the San Francisco Bay Area, let me say good day to Dr. Mark Howard. Mark, hello there.
Hi, Jay. Nice to be back with you all.
Oh, it's great to have you here. So we had Dr. Howard with us, I think, Mark, a little over 6 weeks ago. We talked about the fact that you're not only a PhD psychologist, but that your wife had breast cancer. And when you and I met at a workshop last fall, I approached you and said, wow, what a perfect person to have on a live Google Hangout because you not only have all the skills of a psychologist, but you've actually walked the talk in the sense that you took care of your wife. And today we're going to focus some, or a lot actually, on what the caregivers need to do to help themselves. But Mark, let's start. Just remind our audience your story when your wife was diagnosed, the wonderful care she got at Kaiser, those kinds of details.
Oh, great, Jay. Yeah, so she was diagnosed with breast cancer in 1996. And, we went through the whole process, right? The biopsy and then the decision of how to treat it, um, and then the care afterwards. So together, she decided to have a mastectomy. And I think she was blessed because the tumor was like at stage 1 and it wasn't aggressive. So the oncologist had even uh, talked about no further treatment, but my wife and us talking together decided to do a course of chemo just to make sure.
Yep.
And so she's been free now since then, since 1996. So I think we were really blessed with that. And the care given by, the Kaiser Permanente organization here in the San Francisco Bay Area.
Yeah, no, it's a great story. And what we talked about before was the fact that today, Mark, we have lots more options than we did almost 20 years ago, if you will.
Yes.
And that your options, were a little bit limited, but there was still a decision-making process that went on back then. Lumpectomy was certainly available with
Mm-hmm.
some radiation therapy versus mastectomy. And
Mm-hmm.
maybe just highlight for a couple of minutes how you assisted your wife in that decision-making process.
Well, again, Jay, what the psychology foundation I'll be talking today about that helped in this is I had an understanding that all of us have an innate wisdom, and so I really wanted to respect my wife's wisdom and support that. Um, again, this is her life, and so what we did, we just made sure we had another opinion, met with another surgeon, kind of talked it over together, and but most of it was to provide her as much understanding that I could for her taking a look at a very highly anxious time in her life, and just support her around that, and be okay with her decision. Um, we were lucky too with that decision because during the surgery they found some precancerous cells on the abdomen, not the abdominal wall, but the some muscle that would have eventually may have formed further. So anyhow, through the process of it, what helped me was knowing that all of us have a wisdom that we can access to help us through our lives, particularly in times of adversity.
Well, that's very, very well stated. Now,
Yeah.
Mark, just because there are different stages along the way here that I want to focus on this morning, and then we're going to get into the three principles institute so strongly in. How did the process begin for your wife? Did she feel a lump in her breast, or was it a screening mammogram, if you recall? I know it's 19 years ago, but do you recall how the whole thing began?
Yeah, she felt the lump in her breast, through breast examination, she felt it. And it kind of felt odd, a kind of an odd
Okay.
lump design. And that's where it started. Yeah.
All right, so right there, that's very good, because it would either be that or an abnormal mammogram, which in my 30 years of experience of focusing on this disease really sets off a lot of anxiety and fear. Anxiety, if we call it that, is a manifestation of fear. What did it set off in you as her husband?
Well, I was worried, uh, I wanted to be supportive, but I too was worried. And you just don't know what will happen as we go through the different steps toward decisions around treatment and so forth. But yeah, I got worried as well. And in the midst of being worried, wanted to also support her in the fact that she was scared about it as well.
So how did you take care of yourself? Here's this first boom.
Yeah,
Honey,
yeah.
I feel a lump in my breast, and you're being a man now. Okay, you're being strong. Men solve problems. We don't talk about it a lot, all those sort of differences we talk about between men and women. But internally, there had to be some stuff going on in you that you needed to handle. So let's share with our audience how you dealt with that.
Well, Jay, I think once again, understanding psychology helped me a great deal because, through the years of understanding this, I grew up in the years I grew up learning that a man doesn't ask for help, is supposed to stay strong, not have feelings that look like signs of weaknesses. But, through my years of understanding psychology, I helped myself reach out. I think that's a main thing that I'm going to talk about later around really looking at having a support system in your life. And again, also maintaining my level of emotional reaction. And also realizing that there is, again, a source of resiliency available that can help in these troubling times so that the worry doesn't take over my spirit.
There you go. So next step, Mark. Now, back in 1996, we were doing needle biopsies, and that's sort of the early. Maybe we weren't. Do you recall? And the reason I'm asking these details because I want to trace your journey at each step along the way here. Did your lovely wife have an open, what we call excisional biopsy? Is that how the diagnosis was made, or was it a needle biopsy? Do you recall?
Well, again, yeah, she had a biopsy. I don't know what type it was,
Okay.
but again, being talking about caregiving, I went with her. I didn't go into the room, but I sat with her, and as she was waiting, and try to keep my worry low and be of support to her, in terms of just sharing my hopes for her and, faith that we'd work it out together.
Yep.
But I don't know the type of biopsy, Jay, but she did have a biopsy.
Yep. And so then the diagnosis is made. Now the reality that your wife has breast cancer,
Yes.
Mark, has hit home. And by the way, just as a sidebar comment, I, as a breast surgeon, am generally the first specialist, if you will, to see the patient after the diagnosis is made. Part of that is the history of the treatment of breast cancer. You may get a kick out of this. I tell patients that I have 4 roles in their life when I first meet them. Number 1, I tell them I'm their friend and their advocate. Number 2, I tell them that I am their project manager, if you will, because in this day and age, with the choices that we have, there are going to be multiple specialists involved, and I'm trying to organize how we're going to sort of go down that pathway. The third thing I tell them is that yes, at some point in time, I'm going to be their surgeon, And fourthly, I tell them that I'm going to be involved in their long-term care. In other words, the relationship that I'm starting with them is not that of a carpenter. They're not coming to me to have parts out and say, see you later, that kind of process. I also try to embrace their fear because I really get and understand that we're talking about people who are sort of like deers, deer in the headlights.
Mm-hmm.
I know, frankly, Mark, that the patient can probably take in, maybe 10 or 15% of what I'm telling them. And
Mm-hmm.
I always have somebody else with them. The husband, their significant other, mother, father, sister, brother, whatever it is, so that other individual can hear what's going on. Did you find, as you were there accompanying your wife, that you were able to take in most of what the specialists were sharing with you?
Well, first, let me say, Jay, that I just love your philosophy and the caring feelings you have. I really think that being able to have a physician like you with that approach is so helpful.
Well, thank you.
So helpful. And it's kind of the sense I got about you when I first met you. Anyhow, yes, it's so important as a caregiver, and me as the husband to go to everything that my wife is going to surgery or pre-treatment, as well as post-treatment. Every meeting, it's so important because you're so right. The fear just took my wife down a few times in terms of just being emotionally overwhelmed. And
Yep.
when we went, let's just say we went to talk to, just an example, the oncologist post surgery, my wife couldn't remember much, so it's so nice to have somebody there, because that's just so important. Yeah.
Yeah, absolutely, Mark. And did you feel, I mean, your wife's feeling emotionally overwhelmed
Yes.
naturally. I see this every day.
Yeah.
How were you feeling at that point? Were you feeling like you could kind of take things in, or were you making notes or, things like that? How did that process work for you?
Well, again, I think part of it was, once the diagnosis and prior to any, treatment, we both reached out to our support system. So, and I was involved with that as well. I think I just couldn't allow myself to be overwhelmed. I couldn't,
Mhm.
I had the feelings of worry as well as sadness from time to time, but I couldn't let that rent space in my mind,
Yep.
because my wife was just really at times, really in a very overwhelmed place. So I couldn't let myself get to that level of emotional reaction.
Now,
So I
Mark,
had, oh, go
Mark,
ahead.
you do, excuse me for interrupting, and that was beautifully stated. But
Yeah,
you alluded a moment ago to, it sounded like each of you had sort of a support system, if you will. You
yes.
alluded to that. Maybe you could elaborate on that a little bit, because I think that's really important, what your support system was and what your wife's support system was.
Well, the idea of support system comes because I worked 30 years with addictions, and in recovery from that, people need a support system. You need more than yourself. Well, this is a period of adversity in life that you really need more than yourself to help you through that, and so does at least my wife did. And one of the things she said to me early on was she really needed family around. For her, whether I thought that was right or not, I couldn't. Uh, uh, I couldn't like rigidly hold on to my ideas about it. I had to follow what she wanted to do. In addition to that, she had a cousin who she was close to who had just gone through breast cancer herself. So they came over and we spent the day together. And I talked with the husband to see how he went through it. And then, and then bringing family in, my wife's sister and brother and their spouses. Even the day of surgery, we were there with our whole family before we left for the hospital.
Oh, fantastic, Mark. Now, how about for yourself? That's just so beautifully stated. And I
Yes,
think it's really, really important, whether it's your immediate family or your church or synagogue family
yes, yes.
or your social family, but reaching out. And one of the things we've talked about at Breast Cancer Answers is reach out to people. Don't feel ashamed that you have this diagnosis. You know, frankly, back in my training days in the 1970s, everybody got a mastectomy. That was the only option. And nobody talked about their disease, Mark. They
Hmm.
did not reach out. And I think your point is absolutely spot on. But what about yourself? Who did you reach out to during this?
Well, again, I really think that, again, for caregivers, and particularly if it's men, I don't know what it is, for younger men, but again, I grew up in a time where you just hung in there yourself. But again, it's so important to see that you're not always available to yourself psychologically.
Mhm.
So I reached out to close friends, and I reached out to colleagues. I worked in a mental health setting and was close to colleagues, so I was able to talk it through with some of them and family. You know, but we also, there were also some other organizations around. Like for me, there was like a few caregiver groups that were meeting within the Kaiser facility. So I kind of attended a couple of those meetings. But the main thing is like what you said, whether it's with your pastor or rabbi or priest, or whether it's with family, or whether it's actually with a mental health professional, reaching out is so helpful.
Yep. No, I think
Yeah,
that's one of the huge take-home
yeah,
messages here, both for the patient
and for the
for the
caregiver.
Yep, no,
Yeah,
absolutely
yeah,
right, Mark. Well, fast forward, you got through
yes.
the surgery, you got through the chemotherapy. Now, what I have told patients is this is a lifelong journey.
Hmm.
And so when your wife had to go back for revisits, or if the mastectomy was likely just on one side, and maybe she still needed to have mammograms once a year on the other side, share with us a little bit as you're down the road now, but that spike in fear that comes anytime your spouse has to go back and see a doctor or have a mammogram or whatever. Did your wife experience that?
Well, we had several processes along the way of this journey. I think I talk about it in terms of caregivers around making adjustments with your expectations. That one of the things that can affect us is that we have to make adjustments in what we expect in the future. And I think in the journey of even recovery, you have to keep making adjustments of and so it's like kind of bringing it down to helping yourself deal with what you're going to do that week, or the next month, rather than looking way beyond that. I think that helps a lot. But anyhow, our journey was one of course, she wanted to do some reconstructive surgery, and so again, she found a surgeon that she really liked, who Kaiser actually agreed to have the person do the surgery. It was not a Kaiser physician. And she's gone through several of that because of her small chest. Some of the reconstruction, her body was reacting to it.
Yep.
So again, you have to there's an adjustment there of helping her through that period of time. But like what you were saying, particularly early on, I would say within the first 10 years, every time there would be going back for an examination or a mammogram, there were highly anxious times, worry times. So again, it's trying to support one another through that, and again, continuing to help yourself.
Yep.
with going through those
Yeah.
different periods of time in the long-term recovery.
Yep. So, Mark, this has been a fantastic discussion. And to summarize it, I want to get into the Three Principles Institute now, and some of your wisdom with all of us. But up to this point, we've really emphasized reaching out. We've really emphasized, if you will, flexibility and adjustability to the steps along the way. We've really emphasized being there. I think we've also emphasized that caregivers are vulnerable to the same fears and anxiety as the person undergoing the care is, and that the caregiver needs to take care of themselves. So I think that's maybe a good segue to the thing I know you're anxious to talk about now, which is the Three Principles and Three Principles Institute.
Well, I wanted to just talk about these three principles in light of a caregiver, in the sense that my understanding of these, what you might call formless spiritual principles of mind, thought, and consciousness, they provide us with an understanding that we have a capacity to call on a wisdom or intelligence that we're a part of uh, that's greater than us, that's just part of this universe, this life-giving energy and intelligence. And how it comes about in terms of being a caregiver is that it comes about in the fact that you have a capacity for resiliency. And you have a capacity to think differently than just in the overwhelming emotional ways that come to us as caregivers when our spouse or partners has this diagnosis. And so there's a capacity in all human beings to kind of think beyond the adversity. You see it everywhere, actually. It's not something that is unknown. It's just that the principles give us an understanding that this is contained within the consciousness of all human beings. And what that is, you know, you see people facing adversity and they'll say things like, you know, I can't ignore this, but I'm not going to let it take me down. Or they'll say, you know, I just pray to God and have Him guide me. Or they'll say, you know what, we just get started at rebuilding. And it helped me as a caregiver to listen for that. So that, like I said earlier, if I was like worried or fearful one day, or was I getting overwhelmed from sadness, I could help myself not let that sustain my day, and kind of pull away from that and try to listen for something from my own resiliency that would kind of say something like, well, wait a minute here, don't get too far ahead of yourself. You and your wife will work it out. You know, that you don't know yet where that will go. Things like that that's available for all of us in a human capacity to help ourselves through with adversity. So with the principles of mind, thought, and conscious, and knowing we are connected to that intelligence, we can look for something that will come from within ourselves to help us see it in a way that we can use our inner strengths for compassion, for gratitude, for forgiveness. And the other piece really that I wanted to share, Jay, around this is that it's easy, you know, from our learning history to get into the expectations that we should be able to handle this better than we seem to be handling it as a caregiver, you know. And you want to be careful with those expectations, because what I have seen in helping other caregivers is that they set the bar too high for what's humanly possible, you know, for themselves with their thoughts. Their thoughts create expectations that they shouldn't have a day where they're overwhelmed, or they shouldn't be frustrated with their spouse or partner. They shouldn't be angry about the cancer. They should always be able to handle these additional tasks that they may be given, you know, they may now have to take on, right? As their spouse or partner can't handle those tasks. So again, the secret with understanding these principles is that we start to see that there's ways of thinking that don't allow us to just have understanding for ourselves. to give ourselves love and understanding too. So what you want to watch out for are those shoulds, those ought tos, those I should have, and things like that, because those are telling you you're thinking in a way that's setting your expectations too high for what's humanly possible. And I think once, as a caregiver, you start to have understanding for the fact that you may just have complete frustration one day. You may get short-tempered with your spouse, and you might just, and those things happen as a human being. And you could just give yourself understanding for, kind of getting caught up in that for a bit. That will help a great deal with the emotional issues that come up as a caregiver. And that's how the principles have helped me. I kind of watch out for my getting kind of caught up in judging myself or blaming myself or things like that. And pull back, pull away from that, and try to quiet my mind down and regroup around that understanding that I wait to hear from my own resiliency. So I hope
Oh,
that makes
Mark.
sense, Jay.
Oh, it's so beautifully stated. I was just thinking to myself, I'm gonna ask Christina maybe just to take this last segment and make it a separate posting at some point. So beautifully stated. Besides your three principles institute, Mark, are there other written resources or other things that we could share with people that they could turn to help guide them at this time?
Yes, I think that what's helped me a lot in being able to use kind of a spiritual wisdom and that energy that we are to, first of all, to maintain my own emotional bearings in this journey with my wife has been the writings of Sydney Banks. So the writings of Sydney Banks, and he has video programs out. Those are really helpful. I love also listening to, on Sunday mornings, Joel Osteen has a half-hour program at 10 a.m. I don't know where that, I know it's syndicated, but he has such an uplifting message that it's really nice to hear him as well. But if you can find some of the Sydney Banks writings and so forth and books by Sydney Banks, I think that will help you a great deal to wake up in you this resiliency and wisdom we carry around with us.
Okay, well, Dr. Mark Howard, from the bottom of my heart to your heart, I just want to thank you once again for sharing with us your thoughts, the privilege of having you here with us at another live Google Hangout. Any wrap-up final thoughts, Mark?
Well, Jay, thank you so much. I just love being able to share with people. All I could share with people is hang in there. Hang in. You have the wisdom of the world available to you, even if it looks tragic at times, and really adverse at times. You don't want to look at it from the level of that adversity. You want to be able to come back to your own wisdom. It will guide you. But I just want to share with everybody, hang in there, and just follow the journey as quietly in your mind as you can. I know that's not easy. I know that it's not always going to be there all the time, but if you could always find ways in your talking with other people or whatever you're doing to help yourself to get to a quieter mind, that will help you, because in the quieter mind, wisdom comes, well-being comes, and that's what you want to hear from.
Okay,
It was
Mark.
just, Jay, again, it's just been a pleasure to be able to share. I hope it's been helpful to people.
Oh, and there's no question it has. It's been helpful to me personally as a caregiver, quite frankly, and I know it's helpful to our audience. So on behalf of the staff at breastcanceranswers.com, we want to thank all of you for the privilege of your time today to be with you. I want to once again thank Dr. Mark Howard. He's at threeprinciplesinstitute.org. Please join us again in a future live Google Hangout. Have a wonderful and blessed day. Thanks so very much.